Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic. So I wanted to talk about a very important topic, and that is heart disease, and in particular heart attacks in women, especially around the perimenopause and menopause, and why this may get missed and why often there is delayed diagnosis, which of course can result in poorer outcomes, including the risk of mortality. Now, it's really important we have more understanding about this. And I'm going to explain why there might be differences in how women present and how they present differently as well. So let's just go through all of that. It's really important that we are raising awareness and recognising this so that women can get help earlier and get the correct help to get the right diagnosis to improve outcomes. So if we just look at now, why does it happen? So if we think about some of the research that is ongoing, we've got outdated research and medical bias. And what that means is traditionally research has been based on men and men's symptoms. And therefore, of course, if women are presenting differently, those symptoms are not going to be the same. And the research done does not necessarily help us diagnose and correctly manage women with the same disease. The other thing is there may be an emotional bias. And what we mean by that is women are often perceived to be emotional or having anxiety. And so symptoms are often put down to something like mental health rather than it being due to heart disease. Another aspect may be that obviously as caregivers, women don't want to be perceived as being overly anxious, and so may just dismiss their own symptoms and leave it longer before presenting to the doctor. Now, why may this be? What is it that's so different about the symptoms that women experience compared to men? So if we think about what we call the Hollywood heart attack, so that typical what we might see in movies of crushing chest pain, where you're typically holding onto your chest, is what traditionally we've always seen as what chest pain is derived from and what is a heart attack. Now, that is not always the case. Of course, you may get that, but there are lots of other symptoms that you are more likely to get as a woman. And I'm going to go through those now. So one of the other pains is somewhere else in the body. So typically you may get it higher up in the chest, you may get it in your neck, in your jaw, and in your upper back, rather than a central crushing chest pain. The other symptom women may experience is just feeling really sick or vomiting. That can be another symptom. Shortness of breath, so that can be another symptom. Getting heartburn, so that real reflux, so acid reflux or silent reflux, where you're getting that kind of acid there and not necessarily acid in your throat, but that burning there can be another symptom. Women can also present with extreme fatigue. So you just can't put your exhaustion down to anything else but just real fatigue, having investigations, nothing is found. And then another one is cold sweats. So we hear about when you get chest pain, are you sweating as well? Well, you may not even get the chest pain, you may just get the sweats. So you can see how these present really differently. And more recently, I also learned about another symptom is where you feel like your bra is tighter than it used to be. So that real feels like it's just squeezing against your chest. No rhyme or reason, but you've just started to get that real everything's squeezing in and tightening. So these are very atypical symptoms. Now, it's not to say that everyone that gets these symptoms is having a heart attack, but it's important that we are aware that these can present like these so that we do go and get the help from a healthcare professional and make sure we are getting the correct diagnosis and investigation. So I hope that helps just at least raising a bit of awareness about this so we can get rid of the gender bias that is happening. Okay.